Hello. Long-acting reversible contraceptives, or LARCs, are types of birth control. They provide long-term contraception without you having to take tablets on a daily basis. One type of LARC is the implant. The implant is a small, flexible rod that sits under the skin in your upper arm. It slowly releases a progestogen hormone, similar to the natural progesterone produced by your ovaries. This reduces the chance of you becoming pregnant. The main way it works is by stopping your ovaries releasing an egg. It also thickens the mucus at the neck of your womb and thins the lining of your womb. The implant is one of the most effective forms of contraception. It is more than 99% effective, meaning less than 1 in 1,000 women who have the implant for 3 years will become pregnant. This form of contraception is suitable for most women. It is important, however, to check with your doctor or nurse before having the implant fitted, as some medicines can stop the implant from working effectively. There are also some medical conditions which mean that the implant might not be suitable for you. For example, if you have current breast cancer. This form of contraception is excellent for women who have difficulty remembering to take a pill every day. There are a number of other advantages. It works for 3 years. It's safe to use whilst breastfeeding. Fertility returns to normal as soon as it's removed. It can help reduce heavy and painful periods. It is safe to take if you cannot use contraception containing estrogen. There are no serious side effects with the implant. However, it is common for your periods to change. Bleeding may become irregular or lighter. 1 out of every 5 women with the implant stop having periods altogether. Irregular bleeding normally settles within the first 3 to 6 months. If regular periods are important to you, the implant may not be a good choice. Some women may find their breasts become more tender, they experience headaches, and their skin becomes more spotty than normal. Again, this usually settles within the first few months. Once you and your healthcare professional have decided that the implant will be suitable, you need to make an appointment to have the implant inserted. This usually takes about 10 minutes. The doctor or nurse will start by numbing the area at the top of your arm. Then, using a small device, the implant is placed under your skin. You will not require any stitches after the procedure. The doctor or nurse will check that the implant is in the correct position and will show you how to do this yourself. The area may be bruised, swollen, and tender for a couple of days afterwards, but the insertion site is so tiny that it doesn't usually leave a noticeable scar. You will go home with a small dressing and are advised to keep this clean and dry for a few days to prevent infection. You can have the implant fitted at any time during your menstrual cycle, as long as you are sure you are not pregnant. If the implant is fitted during the first 5 days of your period, you'll be protected against pregnancy immediately. If it is fitted later than this, you will not be protected against pregnancy for the first 7 days. You will need to use additional methods of contraception, such as condoms, during these 7 days. It is important to remember that the implant will not protect you from sexually transmitted infections. Barrier methods such as condoms should also be used to reduce the spread of infections. Removing the implant can be more difficult than insertion, especially if it was inserted deep under your skin. If the implant cannot be felt, you may need an ultrasound scan of your arm to find and remove the implant. Contraception services are free and confidential, including for people under the age of 16. Please visit your GP or local sexual health centre for more information. You can also look online at these websites.